If you're still suffering from symptoms of a hypothyroid, despite normal test results, or despite the fact that you're already taking thyroid hormone medication, I may be able to help. Hi, my name is Dr. Robert Gilliland, DC. The first question that most patients ask is, how can you get me better when my other doctors couldn't? What are you going to do differently? Well, the first thing I tell them is I treat them neurologically and metabolically, because you can't look at problems, you can't compartmentalize problems. You can't say it's a heart problem, a lung problem, a kidney problem, or in this case a thyroid problem. Because anytime any one of your organ system or glands malfunction, it affects all the other organ systems or glands in your body. So you can't compartmentalize things. Now, the other thing that I do differently, I run more tests than is typically ordered by your medical doctor or endocrinologist, because we're asking two separate questions. The question that medical doctors ask, do you need medication? Yes or no? So they only need to run just a few tests in order to determine if you need medication or not. I ask the question, why is this happening? What's causing this? And for me to get the information that I need, I have to run more tests to find the underlying cause of the problem. Because once I find the underlying cause of the problem, then it can be dealt with. Medical doctors aren't looking for the underlying cause because it won't affect how they're going to treat you. Now, if you've been to an alternative healthcare provider, and if you're wondering what I do different from what they do, we use the same all-natural therapies. But alternative healthcare providers typically don't use your standard blood tests and lab work that you get when you see a medical doctor. They use things like muscle testing, biofeedback, or they may look at your blood under a microscope. But this isn't giving you enough information to find the underlying cause of the problem and fix it. So basically, I get you well when the others could not, because I do things differently. I run a lot of tests to determine the underlying cause of your problem. Once the underlying cause of your problem is found, it's up to you to make the necessary changes to change the way your body's working so it'll function normally. So what I do is not for everybody. But if you haven't been able to get help seeing a medical doctor or alternative healthcare provider, then I would be your next logical choice, because I practice something called functional medicine. And it's a combination of traditional medicine and alternative medicine. I use the diagnostics from the medical side and the all-natural treatments from the alternative side. So if you're still having hypothyroid symptoms despite doing everything that your other doctors have recommended, then you can come here. You're at the right place. You can go to my website or look on my homepage, and you'll be able to find videos that explains this in more depth. And I also give workshops twice a month. You can look on my homepage and find the dates and times for these workshops. And I encourage you to explore the website. If you have any questions, you can contact me at Dr.G, that's DRG, at swfthyroid.com.